Ko te uri o Taranaki maunga, uri anō no te mana whenua ko te Aotearoa me ngā iwi o Taranaki ki te hupoko o te ika. E mihi ana ki a koutou ki roto i ngā auatanga o te wā o te rangi nei. Tēnā koutou, tēnā tātou katoa. When you get introduced for being involved in the health system for 40 years, you kind of wonder whether it's a recommendation or you've got a use-by date. Before I came in, we were just having a chat with a couple of people, and we were looking around at the number of people who are in the system, and we are in a very small sector, and we recycle ourselves. And I think the positive spin I could put on being recycled, because it's been about 5 or 6 years since I was last in Wellington, is that you come back with different experiences, and so hopefully that's something that I can bring to this new role. This is my first public engagement as chair of the initial commission, and it is a privilege to stand here today to represent the other members of the commission. I want to acknowledge the political support, and I think that's important to acknowledge that. From the Prime Minister through to Minister Clark. This is clearly a government that is in reform mode and wanting to make a difference. I also want to acknowledge officials, Ashley Bloomfield, Robin Shearer, and others across the system for their support in getting this commission underway. But ultimately our goal is to set up the Independent Mental Health and Wellbeing Commission, and we are here as an interim stage to that outcome. So a little bit about the initial commission. We're establishing the Mental Health and Wellbeing Commission. It's an important pillar in the government's response to He Ara Oranga. The initial commission has been established to maintain the momentum from He Ara Oranga while legislation is established for the permanent commission to progress. The initial commission will be in place from November 2019 to February 2021, give or take a matter of months, depending on how quick or slow we are to get to the work. We will contribute to the transformation of New Zealand's approach to mental health and wellbeing, and we will see ourselves as a key contributor, if not a catalyst, for moving towards transformation. And that's a word I've picked up a lot on since I've been back in Wellington. Our purpose is to provide independent scrutiny of the government's progress, and that's a pretty lofty goal to be given. It's something that brings with it its own unique challenges. So to monitor the government's progress in improving New Zealand's mental health and wellbeing. And just in case we didn't think our brief wasn't wide enough, we're here to promote collaboration between entities and that contribute to mental health and wellbeing. And finally, to provide advice to assist the Permanent Commission to hit the ground running when it is established in early 2021. That will involve us identifying some key priorities and even more so, the resources that will need to be put in place to make this program work. Throughout our work, we're going to be mindful of te tiriti o Waitangi. And you'll be aware, or some of you will be aware, of the Waitangi claim, the 2575 claim, with over 200 claims underneath that mantle, and the enormous expectations that sit with iwi, urban Māori, and grassroots people. We heard a lot from the Minister this morning about the clear priority on equity. And I think it's an important part of the Commission's role will be to identify what is working, but also to call out when it isn't working. And particularly, we should be looking for what is making a difference and what is making an impact. Finally, in terms of our purpose and principles, to work out how we can frame up what collaboration looks like. To encourage, to foster and to reward behaviours that embrace collaboration. The key functions and deliverables of the initial commission are to monitor the progress of the government system transformation in response to He Ara Oranga, and to provide advice to the Minister on a regular basis. We have been together as an initial commission for one meeting alone. We've had an initial meeting with the Minister, and we will continue to meet with the Minister on a regular basis. Of course, he's very keen to see us make some progress, and our ultimate goal there in terms of reporting is to provide a final report sometime late in 2020. We've also been tasked to develop a draft outcomes and monitoring framework for the mental health and wellbeing that would be suitable for the Permanent Commission to consider adopting. And in this regard, we're in the process of setting up a secretariat to support the work of the initial commission. We're also tasked to begin to identify gaps in information required to monitor performance under the draft framework and to make recommendations on how these may be filled. We're there to draft up a work program for the Permanent Commission. We literally are starting from a blank canvas, and so it's quite an interesting process of setting something up from scratch when there are such lofty and high expectations being put upon us. We're there to provide input into the establishment of the Permanent Commission, and we can expect some announcements from officials regarding the necessary legislation to set in place the Permanent Commission. So we could expect something regarding that bill sometime soon. Finally, we're here to develop and maintain relationships with and between government and non-government entities that contribute to mental health and wellbeing. And as easy as that is to say, it is really difficult to achieve. And I think there are some experiences with the rollout of the integrated primary mental health funding in some areas where this has in fact been the case. Ultimately, I think it's important that as a Commission, we're able to build a sense of confidence within the system, acknowledge the good intent that is going on, and to elevate what is good, and importantly, to create some momentum for change. If the status quo is important to you, then this train is probably not one you want to be on. Now, this cool bunch of people here are part of the Commission, and if I can just briefly introduce them from your left to right, we have Kendall Flutie, who is the co-founder and Chief Executive Officer of Banker, an education program that teaches children concepts from income, interest on savings, tax, property, investment and insurance. In 2018, Kendall won the title of Young Māori Business Leader of the Year, and earlier this year won Te Whetū Maiangi Award for Young Achievers. Secondly, we have Kelly Pope. She is a mental health advocate, youth worker and writer. She is founder of Crazy Young Things Consulting, which provides consumer advice relating to mental health and youth peer support. She is also a child support worker at Stepping Stone Trust and a research assistant at University of Canterbury. Then we have Dr. Julie Whariwera-Mika, and Julie is somewhere out in the audience. Sorry, I didn't get a chance to see you before we got here. So Julie is a clinical psychologist and lead co-researcher of Manu Arihi, the Flying Doctors. She has more than 20 years mental health experience, having occupied various roles within the sector, primarily as clinical psychologist in inpatient services, adult, child and adolescent community mental health and district health board services. Dr. Whariwera-Mika's broader areas of research interest are focused on improving Māori mental health and wellbeing, mental health service delivery, support services for survivors of sexual violence, and Māori mental health workforce development. And finally, most people I'm sure in this room will know Kevin Hague, who's a former Green Party MP and the current Chief Executive of Forest and Bird. He was previously the Executive Director of New Zealand AIDS Foundation and Chief Executive of the West Coast District Health Board. As I said, we've had one session together. It was an intense session of induction and team building. And what I can say from that initial meeting is that we are very strongly aligned in our values and in our drive and our reasons for being part of this work. and as I've said in the previous slide, we will bring energy to this piece of work. Between us, we do bring diverse thinking and experience, including a broad range of lived experience. So what we're building on, I'm a great fan of history and context. And if we go back to 1996, the Mason Report led to major step change in the mental health and addiction service system 23 years ago. The original commission led to the establishment, the original mental health report led to the establishment of the first mental health commission. The commission was considered to be a strong, effective, and influential watchdog that improved public confidence. The previous Mental Health Commission monitored and advocated for the interests of people who have experienced mental health distress and addiction, and promoted and facilitated collaboration and communication across the system. He Oranga set the path for the next major step, and part of our role is to monitor the progress of the system transformation. I just want to acknowledge that the system is under enormous pressure and to roll out these rather ambitious programs that the government has set for us. And I think it's important that we are able to at least scale up, and I would say scale up in the short term, to acknowledge that there is a significant amount of work to be done across the system in regard to change management. And I would like to think that there's that ability to not only scale up to meet that challenge for the change, but also to scale back when we know we're in a state of equilibrium and business as usual. What is our scope? So mental health and well-being is holistic. And for me, well-being means about person and place. You can't look at somebody's well-being when you just look at the person in their own context or the reason why they may be presenting in front of you. It is important to acknowledge the person and their place. And that means sometimes where it's really important to acknowledge the place of whānau and the place of community. We heard Hera this morning talking about devolution to communities, and I think that's an important part of the conversation, that the system should not look to achieve all that needs to be done on its own. In fact, it's just not possible, particularly when you bring place into the context. So, it is important that we take, as part of our role, into account the broad factors that impact on the social and on the well-being of our people. And they include the social and economic determinants of health, everything from housing, employment, poverty, and that very challenging and confronting issue, the pervasive effect of institutional racism. Further, both the initial commission and the permanent commission will look at the wider contributors to mental health and well-being. The initial commission will hold the government accountable, it's a big task, for delivering on the commitments made in response to He Ara Oranga. So this process of accountability is going to be a very public one. It's important, though, that we maintain that this support is maintained politically, because political support through change, through the whole process of change until we bed in the new way of doing things, is important. We intend to work with the new Suicide Prevention Office being set up as part of the response to He Ara Oranga, and we want it noted that addiction will be part of the initial commission's scope of mental health and well-being. What's not in our scope? The initial commission won't advocate for individuals or investigate individual cases. There are some tasks that the initial commission won't do and that the permanent commission will ultimately do, and these are for pragmatic reasons. For example, we won't be reporting publicly on the state of New Zealand's mental health and well-being beyond that which is in the He Ara Oranga report. The focus will be on the rollout of the government's program and to gain momentum, and because the time frame that we have to achieve this important milestone of setting up the permanent commission, it's appropriate for that scope to be limited. to what it is. Communication and engagement. The Commission members are very clear in their own minds and have embraced a different approach in wanting to approach community engagement and engagement across stakeholders in a very different way. We want to acknowledge that people who are included in this slide, whānau Māori, people with lived experience, families, disabled people, Pacific people, rainbow people, and other communities that are disproportionately affected by mental health and wellbeing outcomes need to be part of designing and developing the new system. Adding on to what is going and what we are doing well, but engaging in a different way and being prepared to be open in our approach to design of the way we do things in the future. So some final thoughts. The initial commission is committed to ensuring accountability, integrity, and I think integrity of the system as a whole is probably an important part for us as a commission to get our head around, as well as transparency across the system. We want to ensure that people in New Zealand understand what the government is doing for mental health and wellbeing and how it is being done. We want to build a sense of confidence from the sector and from the public. We want to instill that sense of confidence that we are heading in the right direction. Nō reire ngā iwi, me maumahara tātou, ngā kōrero o rātou mākua meni atu, nā tō raurau, nā taku raurau, ka ora te iwi, ka tātou tēnā koutou, tēnā tātou katoa.